What's up, fellas?
What's everybody doing?
Oh, man, I'm chilling. How are you guys?
Not bad. Not bad at all.
RJ, welcome.
Thank you.
Thank you for sharing some time with us on this lovely Thursday evening.
Super excited when Matt got you booked. I was like Googling you, and then I was like, oh, this is going to be a good one.
Yeah.
It's going to be a good one. We've mentioned so much about this, and we've never had anybody on to talk about it.
Yeah. So let's get to that in a second. Let's soft dive into this sucker, shall we?
Yeah.
What you give us a little quick story. How'd you get here?
Quick story how I got here.
You take as long as you want. This is a long format show.
Yeah.
It's early, you know.
We'll do a 4-hour Rogan-esque episode.
Yeah.
There you go. Nobody else to listen to. I can't make it through. It's just like
It's okay. I'm gonna order takeout in the middle of it. It'll be great.
Yeah.
At like 2x speed. It's like, come on.
Get to something.
It is good stuff. So we'll go back and wait time, but I won't bore you with all of the details in the middle. But I was fortunate in the 80s when I was in grade school my parents bought me a personal computer.
Which one?
IBM PC Junior, if everybody remembers.
PC Junior.
PC Junior.
PC Junior.
I had a 2C. That was my poison around that same time.
I think I got in at the 2GS.
There you go.
Yeah.
PC Junior didn't last very long, kind of thing.
Mm-hmm.
But it did have a wireless keyboard in
No fucking way,
87,
really?
which is
Wow.
and it had a 20.
I think my cable box had a wired remote at that point.
It had a 20-point font on the monitor, so you could see it from 6 feet away. It wasn't very useful, but I just really got passionate about computers and technology way back when. And yes, I played a lot of games. I had the Atari too, right alongside of it. But I was always fascinated by what I could do, so I started programming. And through high school and went to college for computer science and had the idea that I was going to get a PhD in AI. Back in the 90s. And
all right, you beat the record. That's 2 minutes and 16 seconds, and you said AI.
Yeah.
That's the quickest I think we've ever had it.
There you go. Well, wait. Let me mention, okay, I also raced triathlons.
Okay.
That's the other one.
All right. So, like, I have a feeling now that we've done over 100 of these, people are going to be able to tell, oh, this is a Matt guest.
Yeah.
This is a Tom guest,
Yeah. Yeah.
I was talking to somebody a couple of weeks ago and it was, I don't know, we were like 17, 18 minutes into the conversation and I happened to mention triathlon and she's like, she had a stopwatch.
Yeah.
And she had looked at my profile and knew, I had the experience and she was timing me, waiting to see how long.
Yeah.
So we got it out of the way.
It's awesome.
Have you ever heard the joke, a vegan, a CrossFitter, and a born-again walk into a bar, and everyone in the bar knew within seconds? Like, that's the whole joke, because I wouldn't shut up about it.
Just keep going.
That is hilarious.
I'll spare you from the dad triathlon jokes. So.
Oh,
yeah.
God.
Oh, yeah.
It's okay. Matt's got to update his profile, too, so you want to throw a few in there, it'll be fine.
For sure.
But yeah, I was going to get a PhD in AI. That was my world. And, reading Isaac Asimov and all the, sci-fi greats. This was my world. And then I got a job offer and it was like, more debt or, go out in the world and make a living. So I did go out in the world and made a living and started programming mainframes, which was always fun. Worked for US Steel in the tubular industry. Learned all sorts of stuff about steel. Worked my way through the consulting companies, organizations, pharmaceuticals, and then in 2003 started my current company, Estenda Solutions, where we focus on digital health, software development, data analytics, and AI, which just makes it amazing that we get to help people living healthier lives every day. It is fascinating. But I think one of the things in that technology career that I realized early on was the idea that it's not really about technology. It is about the people and the process. And that's made so much a difference of what I do every day. You're not developing the solution for yourself. You really need to think about the user, that workflow. And it's now the developers that I work with every day too. I constantly reinforce that idea. It's like, yeah, that might look great to you and might work well for you, but you are not the one doing the job. So
did you, I guess the AI side, was that just happy timing that you got back into that when you did, or did something kind of draw you? I mean, obviously before January of 23, 99 and 3/4% of the population had no fucking idea what AI was. So,
Yeah. I've always had my hand in it. Like I've developed the expert systems. Early 90s developed like genetic algorithms,
how sweet.
things like that to like actually, play with it and experiment with that idea. The expert systems went for a while. Predictive analytic systems. That's the forgotten AI, that was there.
Was that for gambling? That was for gambling, right?
Yes. Unfortunately, they didn't work very well, and I'm still sitting here today.
Yeah. They weren't great tools, if I'm being totally honest.
It's always the bears for some reason.
Yeah.
I got to work on those algorithms. So, but yeah, those they make a difference, and so I've always sort of had my hand in it. And the algorithms, we've worked on medication recommendation algorithms. In looking at data to do decision making, which has been fascinating. And as we've been doing this for 20 years in healthcare, we've moved from a world where there was barely any data. Like healthcare is the last industry to really embrace data. There's a lot of technology.
And that sounds insane, doesn't it? Because isn't that what should be driving outcomes and therapeutics and every part of it? It should be data driven.
Yes, very important life-saving decisions in a lot of cases should be data driven. Unfortunately, it's getting better. It's getting a lot better. Don't get me wrong, it's getting a lot better, but it still has a long way to go. But
it does crack me up, though, when people start to dip their toe in that water. I don't know if you read, what was it, Tom, last year or the year before, where I think it was United Healthcare was going to start mandating that their AI agent approve any films prior to a payment being made. And I was reading that, and all the review, all the feedback was from radiologists who were like, no, it's bullshit. No. And I'm like, well, this is somewhat predictable now, isn't it? And oh, by the way, it's like a gabillion% more accurate. So,
yes.
Well, didn't we talk about that where like I said, the one bias that might come out in radiology specifically is AI can tell the race of a person based on its X-ray.
Yeah.
And we have no fucking idea how it can do it. Like humans can't do that.
Yeah. The crazy part of this, and everybody is afraid of biases in the treatment, and it totally exists. But there's also bias in humans too.
There's bias in getting out of bed in the morning. I mean, it's unavoidable. But guess what? It also got us here.
But like as long as we know that with the AI and we train it not to be that, correct? I mean, that solves that problem. I think the biggest thing is when we talk about healthcare disparities, right? Like I had a woman that came in, she had giant fibroids. And I said, look, you're well educated. They didn't tell you that you have estrogen dominance. She goes, no. And I'm like, I should not be making this diagnosis. You came in for hair loss. You lay down on the table. I see a lump in your abdomen. Like I don't have to be a gynecologist. That's your problem.
Yeah.
And I go, well, she goes, well, why would my gynecologist say this? I'm like, you're going to make me say it out loud, aren't you? You're a black female.
Yeah.
They brushed you the fuck off.
It unfortunately it happens. Like we've seen it in the research of like pain medicine.
Yeah. Exactly.
Same thing in the data. So if you're using that data and don't account for those biases, well, what do you think the AI is going to recommend?
Yeah,
sure. Yeah, but you're right. If you're aware of it, we can use the technology to overcome these things.
And that was always my big pushback with people yelling and screaming about bias in AI. I'm like, well, that just gets you to the starting line very quickly. You can fine tune that, once you have it in action. But yeah, I mean, it's inevitable. Whoever built trained the damn thing is their footprint's going to be in there.
Coming in with their pre-programming
But that's sort of the whole point, right, RJ? Like put a bunch of data into a pot and stir it up really, really, really fast. And this is what happens. Like, and I think that eventually does work in our favor. But I mean, we're not going to get any bitching about the biases, right? Like that. We're stuck at the starting line if that's the case. So what do we Oh, I mean, what have you seen? I'm actually super curious to hear your answer to this because I only get, look, I'm in this just like every other tech nerd. I'm, waist deep in this 24 hours a day. I love it. It's super interesting, but I only get like the news and Google search and obsessive midnight searching, tips. I don't necessarily get the perspective of someone like yourself who's got like a very long, history with it. Have you seen how have you seen this progressing and like what's the trajectory going like in this realm?
It is early stages, obviously. I'm trying to think how do I go beyond sort of what's out there. It is very early stages. The challenge with it is that it's progressing faster than we know how to handle.
Yeah.
Faster than we can legislate it. But it's just, we can't legislate that fast. By the time you legislate it, it's beyond it. The FDA can't keep up with, the pace of the algorithms that are being developed. So they need to sort of rethink their approach. And they are definitely, working on new ways of pre-certifying vendors and things like that have good processes instead of looking at every single deployment. How do we change our processes to better handle that?
So RJ, without cutting you off here, is it similar to the way that they have, I guess, the way that they would go through a drug certification process? Is it similar in that where it's like, here's the standard procedures in development and here are the hurdles and the steps?
Yes, and there's specific legislation. The software is medical device, SAMD, SAMD.
Okay.
Yeah, that guide the certification of these systems and algorithms. But if you're not selling it and you're just using it internally, don't have to go through that process. So that's one of these interesting challenges. More and more entities, are out there doing their own thing and experimenting. And if you're not selling it, then you don't have to go through.
So when you're saying these entities, are they like hospital systems
or the health systems, and they are, they're not hiding anything. I don't want to make it sound like they're not going to FDA, so they're doing something bad. And they're experimenting. They are being careful. Transparency is huge in all of this. In testing it to make sure, first do no harm. Totally, applies to everything that any of these.
I mean, is that really a lean in for these guys? Like, do they believe that sort of, or are they doing that as like a CYA? Like,
I get challenged because there's all these organizations that are creating AI ethics policies, and that's the CYA. It's like, we have this ethics policy. But in my mind, you have the Hippocratic Oath. Like, first, do no harm. Like, this isn't new stuff. You're developing technology, and now you're new AI. Now you're using AI. Why do you need a new ethics policy around the use of AI?
Yeah, that seems pretty comprehensive. Do no harm is
that's an interesting take on it.
Pretty nice blanket statement there.
Yeah, but I'm not a doctor. I'm not bound by Hippocratic Oath. And so, I can get in there and do all kinds of weird shit, and I'm not bound by anything, right? So I think that the ethics.
But is an ethics policy going to bind you to anything either?
No,
it's
not likely.
You can,
no.
The Googles, the Apples, they've all signed on to these various ethics policies and stuff that are promoted by various organizations. There's no,
there's no teeth in it. Yeah, for sure. Yeah.
If they don't, who's going to call them on it?
And by the time they've already done whatever they're going to do, it's already too late. Yeah. It's already out of the barn,
Yeah.
Well, it's funny. Like Silicon Valley has really mastered the apologize, don't ask for permission paradigm, haven't they? Like they just nailed it, right? Like it's like, all right, well, we're just going to fuck everyone over. And then by the time anyone catches it, we just go, oh, sorry, man. We'll change our privacy
policy. You're already on to the next thing, too. Yeah, we've already on to something else.
New ways you haven't figured out yet.
The difference. So if a company does come along and create one of these systems and AI and kind of thing and is selling it, then the FDA can come in and be like,
hey, then they can come in, yeah.
What are you doing with this? There are ways around it. Okay, we're developing a system and it's not making the clinical decision. We're providing advice to the clinician who's making the decision. And that's how a lot of systems over time have been developed. They're not telling you what to do. It's like, here's advice.
Yeah, but here's the problem.
But that you could say that with even if they were saying this is the diagnosis, it's still just right on a computer screen.
The gray line, you know, when
Yeah.
you do boxes, it's like, okay, how much do I claim here? Well, okay, the debt didn't really count. Yeah, sure. So yeah, but there is surveillance. People out there are watching this kind of thing.
Well, I think it's funny too, like when the writers' strike that we bring up as a example of kind of weird thinking a lot here. It's like they're like, well, you can't use ChatGPT. That's part of our contract negotiations. And I'm like rolling my eyes because I'm like, every one of you motherfuckers is going to go home and use ChatGPT to get this shit.
And how would they even tell?
And you're never going to fucking know.
How would they even tell?
You can't tell.
It's just a thing on a screen that you probably are. You can listen if you want, but you don't have, you know, it's like, of course you're going to listen. You're going to copy and fucking paste it. That's all of us. Like, stop.
Or you're going to change an adjective or two here, maybe move a phrase around and call it your own. Yeah.
No, of course that's what you're going to do. Like, of course.
And there's even guides now of like what to avoid with if you're using ChatGPT or Claude or something like that. Sort of, it's propensities to use certain words and things like that. And yeah, I can recognize. So from a marketing perspective, we, you know, use it all the time. It's like, okay, how can I generate this content really quickly? It's an 80% solution in my mind. Like we're always we add additional, you have to check it. You know, we add our particular spin to it. But it's getting better and better. And if I prompt it, okay, it's not going to, the last paragraph isn't always going to start. In conclusion. Yeah. Like, okay, anytime I ever see in conclusion, I'm like, well, you know,
or it's a sixth grader writing a history report.
Yeah. But ask it to write it like Bill Gates or Bill Murray, and you're going to get two completely different responses. And that's the beauty of it. And that's as I'm walking around talking to people at various conferences and stuff. And I'm always like, do you use it? Do you use it? And a lot of people are like, no, I used it and I wasn't impressed. I'm like, you didn't use it.
Yeah, you didn't use it. You took a
I gotta say, I think it's amazing. I really, like, I've leaned in hard. Matt is at like some ungodly level with it, but you know, anything I gotta write, it's like, look, even if I know what I want to say, I'm gonna check it against that.
Yeah, it's brainstorming. It's just so many use cases, you know, for it from that perspective.
Well, Tom, building on what you just said real quick, and RJ, I think I own a technology company. I think, you know, that's my lens, right? Just to frame the next part. And so I'm always looking at cool ways that we could bring to our clients, like efficiencies or a new trick or, you know, a new thing or a new whatever, right? So that's how it kind of started. But very, very quickly, I got into this space where I'm like, this isn't really a new tool to learn. It is also that, but it's really not that. What makes this really hard, I think, for most people is that it's a complete reconstruction of your cognitive checklist on anything, decision-making, planning, execution, all of it. Like the entire system is expunged and a new one is being born, right? Like it's a complete swap. To the degree that people fight that transition, there's the same degree they're stuck and can't do this. And I think this is where, to your earlier point, healthcare is going to really suffer, I think, if we're not sort of all urging it forward. Because if they are the laggards, just like they traditionally have been, then recalibrating a new way to think about how we ingest, process, and display data with health, you're going to leave it to the Googles and the Apples because they're going to be moving at the speed of commerce. And, you know, healthcare is going to be moving at their speed, which is nowhere fucking near this. Right. So,
you know, in healthcare's defense, we're dealing with the health of people. You do need to be cautious. Yeah. So there's that you have to consider that. But I think a lot of the early use cases that we're seeing out there are administrative, less risky, ambient listening. You know, so doctor doesn't have to sit there and type in their EMR.
Yeah, I gotta say, I messed with Freed AI for a little bit. And I was so surprised because here I am, it's on my phone. I have it open, told the patient, we had the conversation, and it picked up that, hey, there's a third voice in that room and it's got to be related to the patient because it's answering some of the patient's questions. And it was creepy, but, you know, look, my soap notes never looked so thorough.
Yeah.
You know?
I've seen this anecdotally, but where use of it has to change how that encounter, because it's taking the notes where, you might be listening to a patient's heart or something.
Yeah.
And detect a murmur, like, unless you verbalize that,
Yeah.
the ambient listener isn't going to pick it up.
Well, yeah.
So there is that change in sort of, I'll call it bedside manner. But
yeah, RJ, 100%. I'm an acupuncturist, so it's not like I'm sitting there going, I'm needling this point now. I'm going to go over here and do this.
No, but you know what though? That's a prime example. You couldn't have teed that up better, RJ. Like, that's a prime example of what I'm talking about. That's a different way of thinking for Tom or anybody to do. So in his mind, if a recalibrated Tom were to, be hypothesized here, we would say that Tom would say, this is important. It needs to be in the notes. Therefore, I'm going to enunciate it clearly so that it can be picked up and annotated, right? Like, but that's not how you do it now.
It's easy enough, Matt, for me to hit record when I walk out of the room and said, I needled these points. And like my dentist does that with his, like when they're doing the tooth cleaning, they'll go, okay, text to type or whatever the prompt is, and then it'll go, okay, six, no, not sixes. Yeah. Hopefully my gums are better than that. Like 222, okay, 222, and then he'll look over and he'll say, oh, look, it's on the right teeth. He moves to the next section. Yeah. So they're using it. I mean, that's not really, I don't know if that's AI or that's just voice recording there, but it's moving in that direction.
Yeah, I'm waiting for. So you take that, and you take the idea that it's really good at summarizing and being aware of what's in that patient's note. So you're putting this information together, and now let the AI start asking questions to prompt new thoughts. And I would surface them still to the physician today because of the idea of, hey, the AI is going too far. But let the doctor see those thoughts, those additional questions. When a physician has that 7 minutes with the patient kind of thing, he or she doesn't have a chance to review the whole chart, might miss something because they're human. But, the patient mentioned something, the ambient listening, the AI can be like, oh yeah, hey, they mentioned this 6 months ago, kind of thing. So let's, ask further follow-up questions from that. So it's a powerful combination of technology that I haven't seen just yet. And
that's super cool to me because that's, sometimes those passing comments are missed, and that's the key to the whole thing, right? And why? You're absolutely right. Even if it's only 7 minutes, or it's like, oh, hey, this happened and they didn't think anything of it because it didn't necessarily fit in with the reason they were there that time. Yeah.
No.
And did you see that new, this goes in the category for me of that. Have you seen that tongue scanner that you put in your mouth, and it, based on the color of your tongue, can tell you like this infinitely large list of shit that's wrong with you? Tom smiles because it's like, oh, that's Chinese medicine.
Chinese medicine.
Yeah, right. Right.
Yeah,
but like, but yes, but at the same time, somebody had to train that shit. And can you imagine how absolutely ninja-like sensitive that scanner must be with the data behind it to be able to do that? Like, that's impressive, man. But a completely different way of thinking about the problem, mostly. Like, it's, Chinese,
But they're going to give you Western diagnoses, not concepts that come to a traditional Chinese medicine pattern, right? And I guarantee you, the more savvy that tech gets, it's not going to sound less like Chinese medicine. It's going to sound more like it.
Oh, I'm sure.
And it's like, not only that, you probably have X, Y, and Z wrong. And we go, oh, in Chinese medicine, this is that pattern. We would expect that.
Right. Right. And then once you build that whole construct into your point, it spits out the entire diagnosis and everything. It's like, all right, well, here's the course of treatment. Here's what to expect. Here are the other shit.
And probably, Matt and I, we totally had this conversation before when I'm like, oh, AI is coming for Chinese medicine. And it was like, I'm watching this fight on Facebook and I'm like, oh, this is why I don't go here anymore. But like, they're like, there's no way they could do what we do. It's a computer. And I'm like, we're talking about thousands of abstract data points that somehow we need to be conscious of, pay attention to, and assimilate into one working treatment plan. And you're going to tell me that a computer that moves billions of data points instantly is going to not be good at that?
Yeah. Faster, more memory, doesn't forget.
Yeah. Hey, you remember when you said your uncle did this, and you're going to be like, hey, this Chinese text mentions that.
Yeah.
And that's what I love about it.
Yeah. I'm not the first, but it's augmented intelligence. That's really,
yeah.
You know, like trying to get people to accept this, and it's augmented intelligence, not replacing you, not yet anyway. It's augmented intelligence. You know, how do we use it to enhance our abilities, to let doctors be doctors, nurses be doctors, and get back to, you know, doing the care of the patient? You know?
Yeah.
So
is your passion in the hardware side? Like, is that where a lot of your work is? Or
we are totally on the software side of things.
Sorry, I meant your output is on wearables and like the hardware stuff that's out there right now, or like or is it in clinical settings as well? Like what's the output?
Yeah, it's usually getting data off devices. So we don't do anything on the device. So we're getting data off the device. We're developing like the mobile application, you know, which is accepting that information and processing it. But yeah, it's like, how do we make sense of the data, the information, find the patterns, and make the recommendations, provide the advice, the feedback on next steps. And that last part's the key to it, because talk to a lot of startups and they're like, oh, we got all this data and we're going to show the doctor the patterns. Like, and then what?
Right.
And they're like, well, that's it. I'm like, they don't have time to consume yet another interface, yet another set of data.
Yeah, data points. Yeah.
What it is. So yeah, you really these days try and push everybody to go like that next level. How do you actually provide value? And you know, there are conversations of like, well, the doctor's not trained in this, they're not really used to looking at this data, so we're going to give them patterns. I'm like, well, you just told me they're not trained in this.
Right.
So, you know, you need to take it to the next level. I try and ask the question a lot of, you know, there's the concept of 5 whys. You know, it's like, okay, I didn't get up this morning. Well, why? I didn't set my alarm, but why? Well, I had a cocktail or 2 last night. You know, why? Well, that was a rough day. So, but in the data analytics world and what we do, it's like, it's now what? It's like, okay, here's all this data. Now what? Here's all these patterns. Now what? You know,
so how do you wrestle with that question? Because that was going to be, one of the questions I asked you tonight was basically like which is another thinking flip here, but you have no more rules anymore. There's no limitations. There's no rules. Like, you can do whatever the hell you want. And so much so that we're inventing ethics boards to determine what we can and can't do, right? Like, so it's when people say like cutely or smugly, oh, it's the Wild West, it's the wild fucking West out there. I mean, it is a lawless land of data flying everywhere, and you can do whatever you want with it. How do you even start to sort of make logic out of that with humans in mind? Like, do you guys have sort of a construct of like the general direction? I mean, I don't know. It's a big buffet you got to choose from there, you know?
It is. I like the idea of the buffet. And so we don't develop software for ourselves and sell it. We're the professional services firm. So we're working with these different entities and organizations, and it's building on their comfort factor.
And are they setting an endpoint and then you're determining how to get there? Or is it, well, what can you do for us? And how is that usable?
It's always a combination. We're very collaborative from that perspective. And how far can I like pushing the boundaries. What can we do a little further? You know, sometimes the organization, the physician or the PhD that we're working with, the nurse that we're working with, like that organization's a little more cautious. And it's like, okay, but everything goes to like a clinical trial. Like it's, you know, because we are dealing with the health and wellness of people, a lot of what we do is that clinical decision making and presenting that data to either the doctor and in some cases the patients. You really got to make sure it works. And that's what it amounts to. It's like, so it's one thing for me to sit here and be like, oh, great, it works. One thing for, you know, Dr. Bob to be like, oh yeah, it works. That's where the rubber hits the road of like, run those clinical trials first with a few people and then ramp it up and you know, do the analysis to make sure, yeah, this one is making a difference, because in a lot of cases, you know, it might not make a significant difference. And so then what's the point of like even, you know, continuing? Let's rejigger this and let's try a different approach. But it is challenging because, you know, probably 2008-9 kind of thing. I remember we did some medication recommendations around diabetes and sat in a room with a dozen endocrinologists, and we had patient profiles. And there's a dozen endocrinologists, and there's like 15 decisions on what to do with that patient. And they're just like, okay, RJ, good luck. Thanks. Yeah, it's a lot of consensus building, from that perspective. I saw, go ahead.
Oh, I have so many questions around the clinical trials. Are these side-by-side comparisons? Here's what the doctor would do. Here's what the AI is telling it to do. And, are we looking for more accuracy? Is it, blind? Are you presenting the patient both to the AI and then the practitioner and then asking each what the outcome should be?
This is definitely where it gets interesting. The gold standard being like, randomized controlled trial.
Yeah.
Thing, and, blindness and all that type of stuff. It gets hard when you actually here's an algorithm kind of thing. There's this idea we've created some dummy applications as, sham application as the comparison kind of.
Yeah. How are you doing a control in this case? Yeah.
Presenting more, usually it's just presenting educational content and stuff. So you still are doing something. It's not quite as clear cut as when you're testing medications and you can use a placebo.
Yeah.
It's okay.
But even that RCT standard, if you're looking for better outcomes, blinding somebody is not necessary in that case. I understand that they're still going to say that's the gold standard, but comparative in this case seems to be more beneficial, because here's what 100 doctors do, and they're at 70% success, and the AI is coming out at 80, 95. Even that's statistically significant, and it would be, much more beneficial for the patient. And I think even if you had that data public, that might turn some heads where it's like, no, I'm going to listen to the computer.
Yeah, in a lot of cases, you're running even trials initially separate from patients. Okay, so here are the profiles of the patients. Here's the images that we're looking. We do a lot of stuff in diabetic retinopathy, so. Here are the images.
Oh, wow.
Here's what the computer can tell you. And here's what the human's doing. The retinopathy stuff is interesting because some of the earliest FDA-approved algorithms were in diabetic retinopathy and image detection going back to 2017. If you look at the FDA,
and that's more on the diagnostic side, right?
More on the what are you seeing in the image kind of thing. Those go. If you look at the FDA AI approved algorithms, I think the last count was 925 or something like that.
Wow.
About 700 of them are radiology and image related.
That's
just overwhelming. The computers can handle the images. We were talking about it earlier. The computers can handle those images better than people can. So, but this is where you do have to be careful, and we've seen this, and we just did some research around it. As the camera technology gets better and better, you need to retrain those systems to work with those images. We've even been impacted by it because we use, in one of our programs, ultra-wide cameras. It's a much wider, much more information than, cameras with a very narrow field of view. And the same algorithms don't work. So now you have to train on images that are the ultra wide, much wider field of vision kind of thing. So we actually were able to publish something in JAMA Ophthalmology, which was pat ourselves on the back.
Nice.
It was so making the difference. You have to be aware of those things, and as the data changes, the technology changes, you have to keep on top of those AI algorithms.
And what I think is cool about what we're embarking into right now, you're doing all that stuff and you've got all this data and you're heading in a direction, but all this other data that pops out of the murkiness of the AI side, you could have in studying this, you could have discovered this other thing, or, found out that they have 2 things or 8 things, or, or whatever. And it's like these stats in baseball or football now. They're like, oh, that catch puts him the 3rd highest person to catch a football when it's 72 degrees outside with a northeasterly wind. You're like, what the fuck is that stat? It makes no sense. But they're coming up with weird shit now. They have access to this data. They're just like, okay, here's a new one.
But that's the power of the data. Like, so, as we're working on like real world evidence projects, it's like you're getting this data from mass amounts of people, or globally in some instances. What can you discover with this data? And it's just, we enable that, and then PhD level data scientists are sitting there querying the data day in and day out to try these patterns and trends and stuff like that. Like, they're understanding whale speech because, they throw the AI at it and they're like, whales actually have names for each other.
Yeah, isn't that crazy?
Isn't that crazy?
I figure that out on my own. So
no, God, no. And that's exactly what I'm saying. And that's what is so exciting. Like, we're about to go into like turbo speed, which is awesome. Like, there's so much cool shit that we're going to find out. And where it gets interesting is take your stuff and put it in, say, a Muse headband where we talk to those guys, and they just wanted a pregnancy test or a pregnancy like study. And like, what did she say? Like 500,000 people raised their hand. They're like, yeah, test me. I'm like,
yeah, I'll do it. Yeah.
When the hell have you ever seen an N of 500,000 in a study? Like, that's not.
And
even
that sign
rational.
up time normally takes years and years and years. And literally you send out a Google form.
Yeah.
It's
and
done.
And if you had your stuff like processing all of that, I mean, imagine what clearer data just the fidelity of that data by virtue of the sample set is going to be a lot.
That is an unusual circumstance. We, healthcare in general struggles to get people to sign up for clinical trials. So,
yeah, we even talked about this with the COVID vaccine, right? Everyone's like, oh, it's moving too quick. No, people were lining up to get a shot that they knew nothing about.
Yeah.
Give it to me.
Yeah. No, I mean, yeah, but I mean, even that, like, that was a big flip too, right? Like, a lot of that was AI driven, right? And so we say, like, why is this all fucked up? Well, it's not really fucked up. It's just, it's doing exactly what it should do in an entirely new space, right? We never had that say, and we had the RNA thing.
We didn't have the accelerator pedal. Yeah.
And so, like, it's a recurring theme in this conversation is like, hey, we're like just inventing new conversations now that we know we have to. Like, we just didn't know we had to in a lot of these cases, right? I mean, and then we made a joke. What was it, Tom? I think it was like a year and a half ago. We said, there's going to be an AI for everything, including like, migration of bee poop, and I was like, yeah, that's
why not? Why not understand everything better?
Yeah, I mean, it's going to be, and now we're seeing that, right? Like,
well, I want to know what the whales are saying about us. I'm more interested in like, do they have swear words? Are they using them with us? It's like.
That
stuff's crazy, man.
This
Can you imagine?
Boat just hit me.
Yeah.
I'm like the largest.
I'm literally the largest thing in this damn ocean.
So where do you see this sort of heading then? Like, I mean, kind of building on a question from earlier, like what's sort of next in that world? Like, I mean, they've conquered the mountain of getting to where we're at. Like, what are we going to climb next?
Yeah, it is definitely going to be this give and take over time, and finding the next safest, most comfortable place to put it out there.
And is that going to be the most comfortable place for the patients, or the most comfortable place for the physicians necessarily?
And that's a great question. It's for the physicians. Like, I truly believe the patients are going to be much more accepting of this and not care as time goes on. There is this idea of transparency and like letting everybody know that, Epic MyChart can generate the communication to the patient. It's telling me what I need to know. Like, what do I care where it came from? It's as long as I get what I need.
As long as it's accurate and it's moving me towards health. Yeah.
Yeah. That's to my benefit kind of thing. The more it can do for me, I think, to answer your question, we sort of keep diverging off.
No,
but it's the intersection where we're going. The intersection of wearables, that data, and AI being able to interpret it and provide advice directly to you as a person.
And
literally cutting out the medical system completely.
Cutting out the medical system. We have to. There's an obesity crisis. There's a mental health crisis. We do not have enough professionals to take care of it. More and more people are retiring. The baby boomers are getting older. They're going to have more health conditions. But at the same time, those doctors, the nurses, the healthcare professionals are getting older and retiring too.
Yeah.
Someone said, we can't birth our way out of this problem because it's a challenge. Technology scales. That's why I love what we do because, yes, a doctor makes a huge impact in the world, but they're one person, one-on-one patients where we can help people develop technology that can be used by many people. And that's where, you think as that population gets older and you want to age in home. So, my parents are getting close to their 80s. Fortunately, they're still doing pretty good. But, when they do get a little advanced and, where do I want them to be? I want them to be at home where they're comfortable, where they're used to it. I don't want to have to move them into an assisted living, facility. And the technology exists today to start just monitoring them and it doesn't have to be invasive. It's like, okay, well, camera, you can put a camera in there now, it's like turn the Ring doorbell camera around and, or just whatever you want, a security camera and watch them. But that's invasive, so put a mattress under the bed on, the coffee pot, the refrigerator. It's like, oh, okay, my mother got up today. Great. She went to the, bathroom normally. She opened the refrigerator. She turned the coffee pot on. All normal patterns of behavior. She sat down. She turned on the TV. Well, now as the AI is monitoring this data, hey, she didn't get up like she didn't turn the coffee on, and it, hey, message me, like check in on your mother.
A long way from life alert. Yeah.
Yeah, it's non-invasive. They're not sitting there and being like, oh, what's that camera? That red light's on the camera. My son's not watching me. But
right.
And they can stay longer in where they live, and then just for me, the wearables and the technology and the information that's available as a human, and I won't go deep dive into the triathlon world, but it's a huge help. But there are continuous glucose meters for patients with diabetes. Take readings, now every minute, so what's happening within your body, kind of thing. It's amazing technology. A number of the vendors now have these CGM devices for people without diabetes.
Oh yeah.
I wore one of these a couple weeks ago because that's what I did. I was like,
yeah, I've done it too.
Yeah, like I know the science, I know the nutrition, but to see it in my body happening is
different
powerful.
Story.
It's like, so you after you each go for a walk, and it'll help flatten that curve, and the glucose won't impact you as much. So I ran those experiments. I know of one. It's like, okay, eat a meal, don't walk. The next day, eat a meal, same meal, go for a walk, and you can see the difference.
Oh yeah.
I was eating yogurt one day, and I'm like, oh, the next day I put protein powder in the yogurt. Didn't taste as good, but I put the protein powder in the yogurt, and you could see the difference in the profiles, kind of thing. Very, like, mentally, I know that, but to see it is very powerful.
Yeah, but here's the problem, and I agree with you, and I do the same thing. But I have an EMF meter, right? Very affordable, $100 plus or minus. I bought it with a tech hard on, running around my house, measuring everything that you plugged in. I'm like, oh my God, check this out, blah, blah. I got one data point out of that that's helped me for years since, is that the RF or the Wi-Fi antenna for MacBook Pros are on the front. So if you go from Wi-Fi to hardwired, not only is your internet faster, but it literally nearly eliminates the EMF coming off your laptop. And I was like, you know what? I never need to use this tool again. I got my money's worth with this one fact. I sit in front of this fucking thing 10 hours a day. So like, this is meaningful information. But even though I sit here for 10 hours a day and I'm got every motivation in the world to not do it, how many people don't give a fuck? They know that same information. They know it's bad while they're chugging down their 15th Marlboro Light for the day, right? Like, just because I can get all of this data, I'm like, when I found out about CGMs, that you could be a normal person and get one, I was like, my wife was like, no, you're not. You got to draw the line somewhere. And I was like, fuck, But like, That's me. We have a podcast on fucking this
Honestly,
weird topic.
of the things you've spent money on, it's like $35, man.
No, I
Yeah.
know. It's not a matter of
They're super affordable. My only problem with them is I'm a fucking bull in a china shop, and I've bent every needle of every one I've ever done about a
That's
week.
so
And I'm
funny.
like, you get 2 weeks out of it, at about 12, 13 days, I'm banking off a door frame and go,
Yeah.
what the hell was that?
Yeah.
Oh my God.
No,
But yeah, like it's great for guys like you, me, and Tom will have that magic AI machine measuring our ring, our arm, our leg, whatever the hell we have to measure. No problem. I see that in all of our futures, and I can't wait for that minute. But that's what, single digit percentage of overall population. Like,
but once the technology becomes more consumer ready, once it's more like the data, like, you know, who's going to sit there and look at their fucking glucose level 20 times a day? But as the AI interprets that, as we get the technology gets better, so I don't have to sit there and, hey, look, I had 14 P's, and
Yeah.
and I took a photo of my plate. Imagine that, and then all of that data is there, and it's like, it's going to spit out, hey, maybe tomorrow eat this. Like, at that point, it's so consumer friendly.
Yeah, it definitely is moving in that direction. It's getting more consumer friendly. It's fading in the background. You used to have to wear a watch. Now you can wear a ring. Like, it's pretty soon they're going to have like contact lenses and all sorts of other things that are just really easy to wear. That it's a piece of jewelry. It's not a wearable. It's just part of, okay, I wear it every day. I wear it to sleep to figure out what's going on. It's the other thing that is going to happen more slowly and really needs to happen is the healthcare system needs to change.
Yeah,
we have a sick care system right now.
Sure.
And there's part of that is we're not accountable for our care anymore. It's like, oh, I get sick, I just go to the doctor and they'll give me a drug and then I'll fix it, kind of thing, and I'll get all better. We're not accountable for our care. Like, I have this goal of, it's funny, for the longest time I was saying, my goal in life is to live to 100 with a high quality of life. When I do my triathlons and I see that 80-year-old guy out there, I always go and talk to them. I'm like, how are you still doing this? I want to be you. And then someone said to me, why only 100? I was like, you know what? You're right.
Yeah.
I want to live to 100 plus with a good quality of life. And I recognize I am not the average person in saying that. I work with a lot of people that, have similar mentalities, kind of thing. So there is that shift from a society perspective, and the healthcare needs to move to value-based care, where the health system is incentivized to, prevent people from getting sick and move out of the four walls of a hospital. So much of your health doesn't happen while you're in the doctor's office. It happens day to day in what you're eating and movements. I try and be really careful of not saying exercise. Just move.
I mean, we're seeing studies now, like 30-minute walks a day, right? Radically shift your health. So, I'm not doing marathons.
You don't
have me lift heavy shit. I'll lift heavy shit. But I look, if you're telling me, look, put on your sneakers, go have an enjoyable walk with your wife and kids, sign me up. That sounds great.
Yeah.
I'm going to have to wait until they're not teenagers anymore to have an enjoyable walk.
Yeah.
It's something, and AI, I think, is going to make that even more concrete, right? Like, we understand the reasons why we do this now.
Yeah. And it can change and respond too. Like, I think that's another interesting aspect of what it's capable. One, from an educational level. So it's like, you get a diagnosis of cancer, God forbid. You're stunned. You don't remember what the doctor said when you leave that office. Like, okay, now let me interact with the hospital's AI system. What does this really mean to me? Okay, I didn't understand that. Can you make it simpler for me? Okay, Here's simple. No, I still don't get it. It explains to me like I'm a kindergarten. Okay. And it can just how it explains it, like, on the fly. And same thing from like that behavioral motivation perspective of like, okay, we're trying this. My user hasn't done anything different. Well, let's try a different approach. The carrot didn't work. Let's try the stick.
Yeah.
and see what the
It's going to
person
be a
responds
shock
to.
collar. Is that what you're saying? It's
Yeah.
going to be a shock collar.
Got to be a shock collar. The wearable is actually a
We're going to
shock
Pavlovian
collar.
the shit out of this.
Yeah. Right.
Yeah, that's the
Yeah. I mean, listen, I want to have more faith in my fellow man, but I just don't. Like, there's no, I mean, the guy who's sitting on his couch, on his second 4-liter bottle of Mountain Dew is always going to want to do that. Like, that's,
They have 4-liter bottles?
I mean, unless they change their behavior, no amount of AI is going to make you want to get off your couch. It's way easier to sit there and drink Mountain Dew than it is to get up and walk around.
That's why I pair it with there has to be that societal
shift towards, yeah.
That of the accountability as healthcare. And it is, healthcare is shifting.
You're starting to see value-based medicine pop up here and there. You're starting to see people understand, I think, and even in my practice, I mean, I don't want to ever say anything positive about a pandemic, but like, we got a hell of a lot busier when people started coming back out. Why? Our aim is well care. How do we keep you healthy? Right? It doesn't have to be anything bigger than that. Like, do you want to stay healthy? Let's do that.
Well, and then there's that thing that, like, I'm paying through the nose for a doctor who will make me well, keep me well, right?
Yeah.
And I probably pay a lot more for gadgets and gadgets that I get to wear and get data from than somebody who can't.
The average
either.
person, yeah.
So, like, I guess it's not that it's a bad thing per se, but I think it is also one of those things where I'm like, yeah, AI is really great if you've got the money to invest in it and be a part of it and use it for your own good. Otherwise, unintelligible gobbledygook that you can't make heads or tails out of, right?
But the speed at which everything's moving, right? We were joking about the earliest computers we all had.
Yeah.
Right now, think about it. Think about that phone that's sitting right in front of all of us.
Oh yeah,
infinitely.
No. Yeah. Oh yeah.
And
infinitely.
Yeah, it might be expensive, but it's like you can do so much more with it. And eventually, as the AI improves, as the wearables improve, and they're going to come down in price.
Yeah, and you're not going to be able to avoid it. Like,
yeah,
it's happening. Apple.
Oh yeah, no.
Apple already rebranded AI. It's now Apple Intelligence.
Yeah, which I thought was awesome. By the way, it's so quintessential Apple. I'm like, this is amazing.
It's what they do.
Yeah,
but you're not going to be. It's there. It's just going to be part of your life, and you're not even. Nobody's thinking, "Oh, that's AI." That's just my phone doing its thing, and so it's going to start fading in the background, particularly as like voice modes get more and more powerful. It's you're not going to be like, "Oh, it's the AI." It's just how I interact with the world. My daughter, watching her grow up. One of them's 22 now, but she always dictated her papers into her phone.
Mm-hmm.
Doesn't sit at a keyboard and type. She dictates, and I was always amazed at that. This is how she does it, and it works for her.
My kids are super impressed that I could type fast because they're like, I can't imagine why I would ever learn to do that. Like they're like,
and other people are having arguments like they're not teaching cursive anymore, and it's like
they're teaching.
You need to pick up a fucking pen ever.
They teach cursive in my kids' grammar school as of a few years ago, just before COVID. They took cursive in grammar school. I was like, get the fuck out of here. Who needs to know that information? I don't know.
I gotta say, moving the kids from Catholic school to public school, I'm like, oh shit, the Catholic school, these book bags are so fucking heavy. I can't believe they're doing. And now, like, what's in this bag? My Chromebook.
Yeah.
Like, where's your textbooks? We don't have them.
Yeah, no, there's none of those anymore. Yeah, who the fuck needs that? You just like ChatGPT. Tell me what my problem is. So RJ, last thing that I'm just curious about, what's sort of your outlook, I guess, for you guys? I mean, as a company, like, are you basically leaning in on the thought leadership side? It seems like you guys are doing great work in that. Like, what's sort of your next move?
Yeah, definitely leaning heavy in that area, because there's just so many people have so many questions. And I love being on the innovative side of things and being able to help people push those boundaries, whether it's a startup or a large organization that we might work with. It's pushing those boundaries. It's fun. It's exploring the edges and helping solve those problems. It's why I love software and technology and what we're doing and all of this to do that. And so the more I can get, that knowledge out in the world, the better off we're all going to be. And it's fun, which is
it's great.
what you want.
And I love your attitude about it too. I mean, I joke along a lot about AI being like the art student revolution, right? Because I really do feel passionately that if you're a creative thinker, AI is what you've been waiting for your whole fucking life, right? Like, it's like, oh my God, I don't have to be bogged down by mechanical knowledge or technical knowledge or anything. I can literally just talk into the air and get shit done. Like, that's a crazy advancement in capacity, right? But it favors the creative, right? So if you're a passionate creative thinker, you will excel in this field. This is a super highway for you.
Changing the world. And if you didn't think it wasn't changing the world, Oprah did a special on it a couple weeks ago.
Oh wow, I didn't see that.
Oprah's talking about it.
Yeah,
something.
You're already late if Oprah's talking about it.
Oprah had the special, and it was like, oh wow, okay, now the world's gonna really what is this? Because there are we're obviously still in a rarefied atmosphere. Not everybody is using AI these days and stuff like that, but if you're not, go start playing with it. Learn.
But it's refreshing to talk to somebody like you who's doing something practical with it. Like, so much of the news cycle about AI revolves around input windows and tokens and this and that. Like, the shit, you know what that means for the lay people? It means that you could type more blog articles for your fucking stupid job, right? Like, that's all that means. That's not super helpful, nor is it like all that exciting anymore. It was really great when we went from to 3.5 turbo and then 4 up. You know what I mean? Like, you go up, but now we're over that. Okay, it's fast enough for pretty much everybody's use. So can we just stop mentioning token windows? Because every client asks me what the fuck that means. And then I'm like, so it's cool to see somebody doing something meaningful with it. And one of the greatest, I think, blessings of this show is that Tom and I have gotten to talk with a bunch of people now that are front row seat with this. So we do get to regularly kind of hear other people's take on what's going on out there, and I love it. So cool, man. Did we forget anything, Tom? I don't know. I think
if people want to work with you, if people
want
to listen to more of this, where do we find you, RJ?
Where do you find me? Well, my address is now.
I leave the
mother's
back door
maiden
unlocked.
name and street address, please.
LinkedIn, obviously, the big place. I'm out there trying to share knowledge. It is RJ Kedziora if you search for that. Estenda corporate website, estenda.com.
Awesome.
They're the easy places to find us. I'll be out at TechCrunch at the end of the month.
Oh, sweet.
So that'll be fun. I think I'm so much in healthcare, and I usually go to healthcare specific conferences.
Sure.
Like, let me go to one that's more broad and see what other industries are really doing and what can I bring back into healthcare.
It's a great idea.
From that. So I'm looking forward to that. There's an organization in New York City called HitLab. I'm at their conference talking about AI in healthcare in December, so I'll be there.
Cool. There's a lot. There's no shortage of AI conferences going on out there. It's like, you can't throw a stick without hitting 5 of them. So yeah, I mean, I get it, but it's cool. That means there's a lot of diverse attention to this topic, right? Which is always a great thing for, getting new ideas. Your idea is spot on, going to one conference and bring back, and guarantee you come back with 10 ideas. You're like, wow, I never would have thought of that.
Yeah. It's like, okay, what's the next company? What am I going to do?
Sure.
Am I missing the boat by just helping other people develop things? I love what I'm doing, but it's like, okay, is there another, do I spin off something over here and do this? We'll see where that all goes.
Yeah, it's funny. I got 2 great ideas.
Frontline seats to some of the coolest stuff going on, right? And if it's not interesting to you, well, you just turn your head,
just shift over here.
Yeah, exactly. Yeah. Cool. Well, listen, RJ, thank you so much for coming on. I appreciate your time. I'm glad we finally got another software guy on here, because
I'm so
sick of me talking
this
about
was like the perfect amalgamation, right? It was software, but it was also healthcare.
Yeah.
Right.
Yeah.
It's right down the fucking middle.
Yeah. Yeah. But yeah, cool, man. Awesome. Thanks again. We'll throw as many people your way as we can, and enjoy the weekend, guys.
Thank you.
Yeah. Take care.
Later.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.